Hey y'all, so 5 reasons why we love labor nurses. 5 reasons why we love our labor and delivery nurses. I'm Dr. Fatou Forna. I'm an OBGYN who works to keep pregnant women safe here in the US and around the world. And labor nurses, I can't say enough about labor nurses. Pregnant women, you need to learn about them. You need to learn about why. If you don't love them already, you're going to love your labor and delivery nurse. Labor and delivery nurses are everything. They run the labor ward at the hospital when you come in to have your baby. They are there. They provide the most care for you during labor. They are going to be the people that are by your side. A good labor nurse is worth her weight in diamonds, not gold, diamonds. They're that important. All right. So let's talk about the reasons why we love them. Number one, we love our L&D nurses because they are the main caregiver during labor. A little bit about their background. They are registered nurses. They are professional. Most of them have their bachelor's of science in nursing. They support patients during and after birth. Of course, under the supervision of a nurse midwife or a OBGYN physician, anesthesiologist. But they are just the most important person on labor and delivery. Again, they spend most of the time with you as a patient. They provide all the medications that you're going to need. They get you ready for an epidural. If you're getting an epidural, they monitor you and the baby. They are the first to know if there is a problem with you or the baby. And then they alert. They'll call the doctor. They'll call the midwife. They'll call the anesthesiologist to come help fix that problem. So you have to have a good labor nurse who can find these issues and call to get help. That's why they're so important. They're your main caregiver. And if you have a good labor nurse, you are just golden. They know all the positions to put you in to make sure the baby comes. Just wonderful. All right. Number 2. We love labor nurses because most of them are really, really, really experienced. There's nothing like an experienced labor and delivery nurse. They're knowledgeable. They've been doing this for years. They understand labor and delivery, the ins and outs. They know all the doctors. They know all the midwives. They know they can help us when we're doing something where we might be able to we might be getting into trouble. They like, Dr. Forna, are you sure you want to do this? How about we do this? So really, really good. They help catch things. They understand normal and abnormal labor. A lot of the seasoned labor nurses, they have a sixth sense. They know when something's not right. When a labor nurse comes to you and say, Dr. Forna, something's not right. Something's not right. You better listen. They can take a look at you, a pregnant woman, and be like, she's going to have a C-section or she's going to deliver easily. They just know, and from all that experience. Now, we do have new labor nurses that are not as experienced, but a lot of the really good hospitals, they will pair them with a seasoned labor nurse and make sure, over time that they get up to speed. All right. Number 3. Labor nurses, we love them because they are the labor teacher. They teach you about everything you need to know while you're in labor on that ward. They are going to coach you about how to push. You might have taken your classes before, but there's nothing like when you're there and you need to figure out exactly how to push. Your labor nurse is going to help you with that. The midwives can help, the doctors can help, but really, number 1 is your labor nurse. When the baby comes out, they're going to teach you how to breastfeed, how to, change the diaper, all of the things that you need to do. They are your teachers. So we love them because of that. Number 4, we love labor nurses because they are multitaskers. They do it all. Sometimes they got 10 fingers. They got the IVs going. They're doing this. They're just everything. I marvel at our labor nurses sometimes. They care for 2 patients. When you're pregnant, it's you with a baby inside. They're doing the monitors. They're checking your dilation, doing all that stuff. And then when the baby comes out, they're caring for you, making sure you're fine, your vitals are okay, you're not bleeding too much, but they're also caring for the baby. We feeding the baby okay? Are we doing this, doing that? So they're really excellent at multitasking. And then number 5, we love labor nurses because they are hardworking. Yes, I'm biased. I think they're the most hardworking nurses in any hospital. Labor work is tough. women are in pain. They're crying. They're emotional. They need support. They're pooping while the baby's coming out. There's blood. There's medications. There's drips. There's Pitocin. There's an epidural line. I mean, there's the monitor. It is just so much going on. And a good labor nurse just takes it all in. They can handle it all. So it would really behoove you to have a really good relationship, to make your labor nurse your friend. Between you, your labor nurse, your family, you're just going to have a fabulous experience with that kind of setup. So Black women, your labor nurse is everything. They are critical to your experience in labor and delivery. They're a very important part of your team, the team that you need to survive and thrive during pregnancy. All right, bye.